The Newsday continues here on One News Now. I'm Riza Diaz. A group of healthcare workers is sounding the alarm on hospitals inching to maximum capacity. Speaking to us earlier, Dr. Maricar Limpin of the Health Professionals Alliance Against COVID-19 says hospitals have already improved their facilities and increased bed capacity, yet they are still nearing full capacity due to the current surge in new infections. The Private Hospitals Association of the Philippines earlier reported that about a third of hospitals in Metro Manila are under critical and high-risk status. The OCTA Research Group is projecting an 80% occupancy in Metro Manila hospitals by April 10.
We are trying to hold the fort, but we are afraid, of course now we are afraid that baka yung holding the fort might no longer last. And we will be sending patients away just because we cannot accommodate them anymore.
And on that note, more public hospitals in Metro Manila are nearing full capacity. Mandaluyong Mayor Carmelita Abalos says the lone public hospital in the city has reached critical level in terms of bed capacity for COVID-19 patients. This as some 49 out of 56 are now being used by COVID-19 patients, marking the public hospital 87% occupied. Meanwhile, the city government of San Juan reports that 25 of the 45 COVID-19 beds at the San Juan Medical Center already have patients. This means that the city's public hospital is already over 55% occupied. The WHO Global Advisory Committee on Vaccine recommends the continued usage of AstraZeneca shot despite the growing skepticism against its safety. The subcommittee reviewed safety data from the United Kingdom, India, and VigiBase, the WHO global database of individual case reports. The subcommittee concludes that the vaccine continues to have a positive benefit-risk profile with great potential to contain the spread of virus. It adds that the reported cases in blood clotting among beneficiaries are natural and in line with the diagnosis after receiving COVID-19 vaccines. The WHO subcommittee is urging countries to provide information campaign as benefits of the AstraZeneca vaccine continue to outweigh its risks. Now, here are other developments from around the world. The European Medicines Agency is still convinced that the COVID-19 vaccine developed by AstraZeneca is safe for public use. This comes after the drug watchdog did not find any definitive link between blood clot incidents and the shot. Following that finding, France has resumed vaccinating its people with a shot from the Swedish-British manufacturer. French Prime Minister Jean Castex were among the first to have been inoculated to restore public confidence in the vaccine. And still on AstraZeneca, United Kingdom Prime Minister Boris Johnson has received his first dose of the vaccine. Johnson is urging the public to do the same, saying the opportunity to get vaccinated is the best thing for all. Now, as more data on vaccines have yet to be unfolded, a common person's question would be, why should I even get the jab? The WHO answers that and more in this video. Let's watch this.
So, Soumya, one of the questions we get often is, when am I getting my vaccine?
What we need to understand is that the vaccine development and manufacturing process is very complex. The fact that we have, 8 to 10 vaccines now that are currently being used at scale itself is a huge achievement. Now, to manufacture 12 to 14 billion doses to cover, the entire world's population, that is a challenge. So this is where we can do some things to help. Firstly, there are a lot of raw ingredients that go into vaccines that are sourced from different places in the world. Now, we need to make sure that there is a free flow of these ingredients happening between countries, that there are no export bans and other impediments to these global supply chains. That's the first thing. The second is we can encourage companies which have the capacity to manufacture, which have the bulk product, to explore with companies which might have some spare capacity to do what is called fill and finish, where you take the bulk product and then you put it into vials. And the third approach, which may take a little bit longer, but it's really looking ahead to the future, is about improving the capacity, increasing capacity to produce vaccines in all parts of the world by technology transfer.
Soumya, the other question we hear often is that since we are still gathering evidence about how long immunity will last from vaccines, and there are so many variants now, why should I get vaccinated now? Why shouldn't I wait?
Yes, you're right. We're learning something every day. We're also learning from all the different clinical trials of the vaccines that have been undertaken, especially the vaccines that are now approved for use, as well as from the rollouts that countries are doing in their populations. And they are actually studying, the impact that these vaccines are having on their populations. And so what we've seen so far is that the majority of the vaccines are extremely effective at preventing severe disease, hospitalization, and death. And that's true across all of the vaccines that have been studied so far. So that is really important, and that's what we want. We must also remember that the more people get vaccinated and build up their immunity against the virus, the less the chances of the virus replicating, growing, increasing, and spreading from person to person, and thereby we're actually reducing the chances of more mutations and more variants.
For more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.